Hey guys, Dr. Frank Gargano from IDN. I want to talk about neurological dry needling. Neurological dry needling is the evolution of dry needling treatment, from the concept of needling points, like myofascial trigger points, into actually needling innervation zones of the peripheral nervous system. Because what we do know is that inflammation, pain, dysfunction doesn't happen in isolation. So trying to treat in isolation is going to reduce your likelihood of having that success. So being able to confine the treatment concepts into basically treating points versus treating areas, I think you're going to have an equally confined level of success clinically. Based on the concept of neurological dry needling, we're based in peripheral and central relationships because that doesn't give us the same type of confinement or limitations that the traditional trigger point models do. So I tell my students a lot that you want to needle the points, that's perfectly fine, but don't forget the system. So an example that I want to use is simple lateral elbow pain. Now, there's probably 8 or 9 different reasons why you can have lateral elbow pain. But in a traditional trigger point model, what you would do is you would palpate in and around looking for the muscles that were sore and tender, those trigger point areas. You'd take a needle, apply the needle, start to do some manipulation or pistoning, and then you would get a trigger point response and a twitch. You'd continue until all the twitching stopped. Now, that's a clinical model. I think the clinical model works just fine. In the neurological model, what we would look at is we would look at the nerve innervation of this region. Certainly the deep radial nerve would be one of those areas that we would look for, but it wouldn't be isolated just to that nerve. We'd look at the ulnar distributions, the median nerves, lateral antebrachial cutaneous. And then we would track all of those nerves as they track back up the arm, through the axillary, into the brachial, all the way back to the cervical spine. And we would needle in the areas that we saw any type of irritation or inflammation. And that's more of a segmental type of needling. And I don't think treating segmentally is all that new to people, particularly manual therapists. We all basically look at neck problems as it relates to the elbow. But what I do think is missing in most systems is the systemic component, the vertical, if you will. And one of the things that's important is we have to understand that the body has a shared neurology and it has a shared circulation. There is no such thing as isolated elbow pain. Right? So in our courses, what we're really looking at is we're making sure you understand the relationships between peripheral pain and central processing and the reverse of that. So I think that's really one of the big differences that we have is between neurological dry needling and traditional trigger points is that systemic component.